At the moment, we're about connecting patients with other patients, and that's the prime reason people come on the site. But we also connect with organisations and services. I think where we're going in the future is much more about signposting, not just to other patients that might be relevant, but to other organisations and the services that can help them manage their health better. My pitch is that we all know it's not news that healthcare is in a bit of a funding crisis, that there are things that are coming out, genomics, diagnoses that will accelerate a certain part of the healthcare journey. But the point is 70% of spending is on the management of chronic disease. And how are we going to deliver that? Well, our hypothesis as a company is that the only capacity to do that is patients helping other patients to manage their healthcare better. So, self-care is not new. It's been around since the dawn of time. What's new is patients helping other patients to self-care better, and we can enable that through technologies that's clever and understands the context of what their needs are, and then can put them in the right direction. It comes down to how democratic we are really as a platform, how inclusive. Is this about high activation patients who know all the drugs and conditions and doctors and all the information, who are just sort of in this little bubble? No, the evidence we have is it isn't. That broadly speaking, you can categorize patients through this measure called patient activation measure. We're just about to do a study looking at patients with low activation, i.e. people who don't really see themselves as a big stakeholder in their own health. We have internal evidence that we have a high group of those people who don't traditionally access help, don't traditionally use digital health apps. And so we're very excited about where we're going to go with that data. First of all, the most basic level, 70% of patients that come to our platform for the first time, they've never spoken to another patient with the same condition before. That is, I don't think we'll ever get away from that being the core value of the system. And that weirdly hasn't changed since we started in 2010-11. Those results have always been that people, even in the world of Facebook, they don't have that access to someone with rheumatoid arthritis or someone with a new diagnosis of cancer. So that's what we provide. But then beyond that, it's all about, if we've got a trusted place which is supported by established patient organisations, how can we provide other parties in a safe and trusted and friendly way and transparently services that can also be sort of tools to help them manage healthcare better, and also enable a better conversation with healthcare professionals, so we don't become an extra silo in health but actually integrate into the processes. So what we're looking at is integrating in the NHS into GP systems, so they can almost prescribe a patient who's newly diagnosed with something like COPD, a community or even an individual that can help them, mentor them, and that's part of the journey. We always feel we don't have that bigger profile, that we're actually quite under the radar. Because we're an enabling technology rather than much more of a sort of platform, our organisations in some way are our brand. I think the other thing is that we didn't raise a lot of money early on, and we actually sort of really sweated it out in the early days. So now, which is 5 or 6 years on from when we really started, certainly 4 years on from good traction, we still there. We're kind of emerging a little bit now as a platform that has actually almost passed under the radar, but is suddenly kind of visibly quite a big thing. Certainly for the people, I think for the patients themselves, there's quite a high awareness, but we're just sort of percolating into institutions, and that's quite exciting. I think we haven't been around the sort of tracking and data side of the empowerment movement. I think what we've been around is using information, experiences, and making that available to as many people as possible. And that, for us, has been the kind of, that you almost see the sort of transformational moment when people have that access to other people, realize that they're not on their own. And it's quite a simple thing, but I think what we see time and time again from the data that we get back is that is the important thing, more than necessarily, plugging in their Fitbit or anything that actually at the moment we don't do. It's still always about the empowerment that comes from realizing there's a community of people to support you through that journey.